Okay, so hi all. This is my great pleasure to be with Professor Carey Morewedge, and this is a follow-up to his excellent talk about when and why do people distrust AI. If you have not watched it yet, I encourage you to watch it. And we will jump in right to the first question. So, Carey, can you please explain your findings to an undergrad student from unrelated field?
Sure, and thanks for having me. It was a pleasure to talk about why people are reluctant to use medical artificial intelligence. And I would summarize the findings of our research as looking at there are many kinds of domains in which people feel comfortable using algorithms and systems that do things that humans do. For example, if I'm going to the airport, I'm very comfortable looking on my phone and using a GPS system to get me to the airport. And I might do that even if I know the route or different routes, right? And I know how traffic changes across time. I still would rely on an algorithm in that case. And I would rather rely on an algorithm than like a cab driver or other kind of expert to make my decision. In other kinds of domains, I might be more reluctant to use an algorithm. For example, in the movie Her, which came out several years ago, the protagonist ends up dating an artificial intelligence, right? And so, in that kind of case, I wouldn't want to have an artificial intelligence system replace a romantic partner, but I might want it to help me give directions along the way to the airport, right? And so, in medicine, artificial intelligence is pervading medicine through radiology and cardiology and all different kinds of applications. And so, in many cases, doctors are relying on the diagnoses of algorithms to assist them in trying to make predictions about which patients will have, which respond to different kinds of treatments. They're also using algorithms to think about what kinds of diseases a patient might have out of potential diagnoses. And so, what we're trying to look at is in the realm of medicine, are people feeling more like algorithms are like a GPS that's helping their doctor? Or is it more like the romantic partner that they don't want to give up? And so we compare people's preferences for healthcare providers that are using artificial intelligence or that are purely artificial intelligence to providers that are more purely human. And what we find is that people generally are more reluctant to rely on an algorithm or artificial intelligence for their healthcare than a comparable human. And they're even willing to sacrifice a little bit of performance to have an AI that is, a provider that is human relative to an algorithm. So our work is trying to understand also why this is happening, why people are reluctant to rely on artificial intelligence or algorithms for their healthcare. And we see that there's sort of two kinds of big drivers in our work. In one driver, like many people think that these systems are really good at understanding sort of the average patient, right? Or that they're useful at helping the majority of people who have typical kinds of cases, but everyone thinks that their healthcare or their health is unique. And so they think of themselves as being a more unique person. And so the algorithm might not be especially attuned to their circumstances or to their particular collection of constellation of symptoms. In the other case, we also see, so people tend to think of themselves as unique and the AI as being less capable of addressing their unique needs than a human. The second case is one in which people tend to believe they understand how other people make decisions, but think that algorithms are a black box. And so, this perception that I understand what my doctor is doing makes people feel more comfortable going with a human healthcare provider than an algorithm, even if they really don't know what their doctor is doing at all, even if that belief is an illusion. And so, these two kinds of things, this perception of my health and my health as being unique and overestimating understanding what my doctor is doing is contributing to people's reluctance to use artificial intelligence and algorithms in healthcare.
Thanks for the excellent summary. I have a follow-up question. I know that it's difficult to make predictions, especially about the future, but still, like I remember about 20 years ago, we were very reluctant to pay on the internet for things, for example, or to
Sure.
buy anything on the internet.
Yeah.
But nowadays, you buy kind of everything on the internet. So, do you predict things will change within time, or no, or you don't have predictions?
That's a great question. And so, a lot of the kind of work in the psychology of technology, you wonder whether or not it's slow journalism, right? So, things are happening and we're reporting on like what the current state of affairs are, right? That's one possibility. Another possibility is that we're really looking at deep kinds of psychological constructs that are not going to change. And so, what we find, and I've found in other kinds of work that I've done, is that people really think about algorithms as different than other kinds of technologies. So in marketing, what we do is often study how people adopt technologies like a refrigerator or a calculator or a smartphone. And we want to know, this is an old iPhone 14. The new iPhone comes out. Are you likely to keep your phone or upgrade, right? And an algorithm, in many cases, like the standard that we use to think about technologies and will people make changes and adopt them is how do they compare to the old technology? The issue where we find with algorithms is that they're replacing what people are doing, right? And so I think to some extent it depends on the unique kind of idea of rather than replacing an old technology, replacing a person who was doing these things. And so the question is like, how much do you identify with that person? How close do you feel to that person? And so if what people do becomes more refined and narrow in the workplace, people will probably be more comfortable using algorithms for what people are not doing. But if people view these sort of things that algorithms are doing as the work that people would do or the thing that makes people unique, I think in those kinds of cases, we'll see continued resistance. And you see that not necessarily so much in medicine, where there's tremendous demand and little supply. So if you think about going to the emergency room, unless you're like bleeding out in the emergency room, it's going to take you like 2 or 3 hours to see a doctor in the US. So in that, like you're in a critical medical emergency, right? You go to the ER, you can't wait to see a doctor the next day. You're still waiting 2 to 3 hours. That's a case where we have tremendous demand and we don't have enough supply of healthcare providers to meet that demand. And so in health, in medicine, doctors are happy to have help from artificial intelligence agents and providers. But for example, in screenwriting, there's a huge strike in Hollywood where the screenwriters are really worried about large language models replacing what they were doing in writing scripts. And so, in that kind of case, there's more supply than demand, right? It's very difficult to become a screenwriter, and you have to compete with a lot of other screenwriters. There's a lot of people who want that job, and few jobs to go out. So there's a bit of economics to it. So to what extent are you in a field where there's more demand than supply of services? But I think there's also a question of whether or not people will identify with the work and think about it as something that they care about. So a radiologist might be happy for an algorithm to, prioritize cases for them to look at, right? They might not want an algorithm to do novel scientific work. So there's other kinds of issues there. So I would say if you think about what's likely to carry through to the future are cases where, there's more, supply than demand of people wanting to do work, and they're going to be feeling squeezed out of that work by algorithms and reluctant to rely on them. And there are also cases where people really identify with work. So, if you're thinking about like would you like an algorithm to come up with psychological theories for you? That might be very threatening, right? That because that's like a core part of being a scientist. If you think about, would you like an algorithm to like go out and collect data for you and run your statistical analyses? That might be more, acceptable because that might be a part of the work that you feel as being like, okay, like I know what I'm doing in this place. I just need to have it done, right? And so there are
Can save me
aspects of it.
time and money.
Yeah. Yeah.
Very interesting point of view, and surprising, I have to admit. Uh, and tell me, please, how do you plan to extend your current research?
Yeah, I think that we've been looking a lot at people's acceptance of algorithms and how people under what kinds of circumstances are people willing to use algorithms or not. And I think there's still a lot of important work to do in that space, but I've become really interested in thinking about how do you integrate algorithms into work so that people can work well with algorithms and not feel threatened when they can help? And also, what are algorithms actually doing to help people? And so, trying to understand the how to and then the consequences of that integration is sort of where I'm looking at right now.
Good luck with that.
Thank
And
you.
moving forward from your uh, personal research to more general questions, what is, in your opinion, the most pressing issue in social science nowadays?
Yeah, I think that broadly, we are in an era where a lot of the kinds of choices and behaviors that we're making are mediated through technologies. So we've moved from, interacting one-on-one or, over letters and phone calls to interacting over voice calls and through social media. And so you could think about a lot of our relationships are being, we have relationships with many other people, many more people than we would before, but they're all being, filtered through social media or through texting or through the other kinds of media. And so trying to understand how these technologies are changing our social relationships, how they're changing how we think about ourselves, how we're changing our decision-making processes. Those are really important and interesting questions to see sort of what holds up from before about our understanding of human psychology, and then what is changing and how can we use these systems to help improve people's choices and help them behave in ways that they would like to in the long term.
This is very related also to the AI changes. And generally, we are living in a very changing society. Like, this seminar was not been able 10 years ago, let's
Yeah,
say. Yeah, very interesting. And tell me, please, what is your vision for our community, let's say 10 years from now?
that's a great question. I think about going back and thinking about as a grad student when I was like, really excited to go to conferences and read the research. I think that there is, academia is and science is recognizing that it has to explain to the public what it's doing. And I think I'm really proud of the work that people have done in the behavioral sciences. I think there's a lot of really important kinds of findings that people have made, and they've been looking at how can we help people make better choices, and so trying to use that and integrate it more into people's lives would be a great kind of step forward, and that could be whether it's in helping in the healthcare space, helping doctors make better choices, helping people make personal decisions that are more sustainable for the environment or that help them reach better financial security. Those kinds of integrations of what we're doing and learning in the lab and in the field and trying to move them into practice, I think is a great way forward. And so that was started long ago, but I think there's a lot of ground for us to cover in that space too. So trying to get people to better understand the work that we're doing, and also trying to broaden the other kinds of disciplines that we're talking to. So there's a lot of push to think about work from an interdisciplinary perspective, where you might be working with someone in computer science, someone in biology, or someone in a public health context. And so bringing together teams of folks together to solve problems that are difficult to answer with one discipline alone.
You are very good at it. You are actually working a lot with different doctors, right? In your own research, in the research that you published very recently.
Yeah,
Like,
so
very
we're really fortunate to be able to consult with some doctors who are working on a skin cancer application, and to talk to them and understand how the application worked. And I always think that like when you have a chance to talk to folks who are doing the work and interview them or like, get to know them and try to understand how they think about the problem, that's always a way to make your work more rigorous as well and more understood more broadly.
interesting. And this reminded me a question that I planned was not planning to ask, but uh, uh, if I remember correctly, you also designed two games, right?
Yeah,
Or am I
so
wrong?
we worked with the U.S. intelligence services, tried to think about ways that confirmation bias might influence intelligence analysis. So they were very concerned after the decision to invade Iraq and like the erroneous like conclusion that Iraq had weapons of mass destruction, that biases like confirmation bias might influence people's choices or decisions in their analysis. And so we built two serious games, which are loosely based on like a first-person detective game. And so
Mhm.
the working title was like "Where in the World is Danny Kahneman?" And then we tried to who's a decision scientist, a Nobel laureate, and sort of founder of one of the founders of like decision sciences and like looking at cognitive biases. And so the game tries to get people during gameplay to solve problems that might be influenced by different kinds of cognitive biases, and then show them how their choices might be biased, and then try to give them some practice and some strategies to reduce those biases. And we actually found that those games tend to show short and long-term reductions in people's propensity to show those cognitive biases, like confirmation bias, which is trying to test a hypothesis in a way that confirms what what you believe, or anchoring, which would be if you're influenced by an initial number when you're making an estimate about an uncertain number, or things like fundamental attribution error, which would be like seeing someone's behavior and overestimating how much of the behavior is due to the person, and underestimating the influence of the circumstances they're in.
That's super interesting. Are they publicly available? Like, I mean, I'm teaching a decision making course. Can I use them for my students or no?
Yeah, the games are publicly available. There's like a very small fee or license. I don't profit from it at all, but there's a
Mhm.
firm that's still maintaining the game. And also the government made two videos that are about 30 minutes each that you can download or watch on YouTube. And if you look up IARPA Sirius, SIRUS,
Hmm.
um, you should be able to find the videos online, and watch those. And those work pretty well too. They're not as effective as the game because you're getting personalized feedback, but they do have long-term like benefits as well for reducing cognitive bias. But
Great. We will definitely. Mhm.
more generally, we found that like there's a lot of interventions that work to reduce cognitive bias. The biggest problem, like in the literature, in studying that, was really trying to understand. People didn't think that these interventions could work, but we found that a big issue was like the measures that people were using. So people weren't trying to really carefully validate the psychometrics or the statistical validity of the measures that they were using to test these kinds of debiasing interventions. And so, we did a lot of work to try to build rigorous kinds of psychometrically valid measures and found that many different kinds of interventions can help people reduce cognitive bias. And I think that's a really important point because, for a long time we were thinking that cognitive biases were like these fixed kinds of pieces of the architecture of the mind, and you could know about them, but you couldn't do that much about it. And so it almost felt like what we were doing was like, telling people about things that they couldn't fix. But the good news is that a lot of these kinds of biases are things that you can work on and things that you can reduce. And so that I think that's encouraging for science and for the public too, to like realize that we're not just victims of these cognitive biases, but we have an ability to work on them and reduce them.
In a sense, we might be more rational than it seems, or we can become more rational
Yeah.
relatively easily.
Yeah,
Mhm.
just as we become more rational from like being young children to being adults, hopefully,
Mhm.
adults have some way to go too.
Definitely. And going from the future to the past, what is, in your opinion, the most uh, interesting or impressive finding in the last, say, 10 years or so?
I mean, I just think there's so many interesting kinds of findings coming out of like what we see with artificial intelligence and large language models and like their ability to make different kinds of predictions. It was, you know, what those models are doing is basically trying to predict what a person would do next. And so there was a paper in 2017 that basically thought that, you know, complex kinds of creative processes would be like the last thing that algorithms could do. And we're seeing that prediction was totally wrong, right? So algorithms are writing poetry, algorithms are making these kinds of predictions, that for like, breast cancer. algorithms are making all kinds of discoveries too. And so it's really interesting to see that those kinds of models come out and just try to understand what we can do with them and what their limitations are as well.
And tell me, please, if I'm correct, you look like relatively young, but already very accomplished scholar. So my question is, how do you manage to find the work-life balance, if at all? How many hours are you working?
I mean, I think it's like very difficult to answer that question because you start off when you're a grad student and you're driving the engine of most of these kinds of projects, right? You're running the experiments, you're designing the experiments, you work with a advisor or a senior scientist to try to help you. You think about how to do it in a rigorous way and like what how to make the question as interesting as possible. And then sort of like after tenure, you continue to do some of that, but like you're much more moving into like a role as like a program manager and you think or product manager and you think about how do you find together like a team of people to do to answer really interesting questions and like who would make a great team to answer this question, and then how do we sort of coordinate that team between the writing and the research and trying to find funding for that work too. And so the roles really sort of change over time. And so you start off thinking about how do you do each individual, getting your paper, like a paper through, right? How do I run the next study? What's the next question? And then once you feel more comfortable with that kind of work, then eventually you're thinking about, okay, well, how do I put together these teams of really good people to like think through these problems, and how do we, do the work in an efficient way between the rest of us. And then once you start as a professor, you start adding teaching, and then once you get tenure, you add a lot of, service and trying to build your institution into a great place. That's good for you, but also good for your colleagues and for your students and for the undergraduates who are trying to learn in that space. So there's a lot of sort of gradual adding of different kinds of work, right? And so it's an interesting kind of process, but I think you have to realize that in science too that you're never going to be finished with the work ever. Like if you're really passionate about ideas and you're excited, you're basically, there's no end to how much you could possibly do. And so it's important to think too about things like your health and things like your family, and try to balance that and sort of find a way to stay healthy and stay, engaged with your family and your social networks too. So that's you have to think about like what do you need to do on those ends as well to maintain um, uh, a, a good life, right? And so you could think about grad school as being a sprint, right? To get enough work done to like figure out what you want to do, get all the skills you need to do to start doing the job. And then once get the job, then it becomes more of a marathon. And then it's thinking about like how do I do this in a way that's sustainable for my health? How do I do this in a way that's sustainable for my family? And thinking about like what are with those kinds of constraints in mind, like what you can do.
And this is definitely a challenge because you are a boss to yourself. Nobody can tell you how much or how little to work, right?
Yeah,
So
yeah. But
that,
hopefully you find out like we go into this work because it's exciting for us and it's fun, right? So it's I'm doing something that I love and like reading about things that I love, and like you can do that in lots of different kinds of places. Right now I'm writing a book and just reading a lot about really interesting things, and you can be somewhere reading an article that um, that's like in a coffee shop, or you can be at home, you can be in the office. It's a lot of flexibility. So um, you know, I
we
think
are
just
definitely
find stuff that
fortunate.
you're excited about. There's there's so many interesting questions in the world to look into, and like you just need to find something that you really feel is not too much work to do. It's more fun.
Definitely. And what the book is about?
It's trying to think about how as we move from a model where we acquire possessions it as like a way of consumption. So you would buy like albums or movies or books or homes and like think about that as being something that you own to consume, to models where we're using more of the things that we consume without owning them. So we're streaming things. People are less likely to be homeowners. So how does that kind of sharing economy and digitization, which is reducing ownership, change how we think about our stuff that we're using and how we think about ourselves? And so the arc of the book sort of has three parts. The first is looking at how we use ownership to think about identity, both like our how we develop our own identity and how we explain who we are to other people through different kinds of cues of the possessions that we own. And then the second part of the book is looking at how like ownership is on the decline and we're moving from owners to users. And then the third part of the book is trying to think about what are some potential directions that might take us. So, are we going to become more attached to what we own? Will we think more about experiences and material goods? How will it change how we think about ourselves and present ourselves?
Very exciting. Reminds me some books about the collaborative consumption and going from finding things to finding solutions.
Yeah.
Yeah, very exciting. And tell me, please, if not academia, what would you do in life? Perhaps become a writer?
I like writing a lot, but that seems pretty academic to me. If I were to have my dream right now, and I'd be an F1 racer, I think, but I think I'm a little too old for that. So, um, like I think in academia, you're doing these like fun things that are, you know, uh, like intellectual kinds of puzzles. So I'm sure like I'd be in some kind of field like that too. But it's fun to get outside and do some fun things too. So something a little more adventurous than being in the laboratory would probably be a good alternative.
Interesting. Tell me, please, how do you find the research questions to work on?
I think when I was in grad school, I was very interested in reading the literature and trying to understand where there are gaps in like theory or where there was theoretical kinds of questions to like resolve. But now that I feel like I understand theory pretty well, I feel like it's really interesting to look at new kinds of problems that people are facing in the world, whether it's in medicine or in um, the law, and try to understand how can we use these kinds of psychological theories to help understand why people are showing this kind of irrational behavior or like how to resolve these kinds of thorny questions about how to get people to think and use more of the algorithms that are available to them for their health, or how do we use what we understand about psychological ownership to help people better understand like how their data is being used and like who owns their data and make more informed choices about that. So, I, that's sort of a way to think about problems is starting off trying to really understand theory and understand the nuances in your field, and then looking at problems that those kinds of theories can help address out in the world.
And you already provided a hint, but still, which hobbies do you have?
Oh, I mean, I have two young kids, so my biggest hobby is it's not a hobby, it's like a full-time job as being a dad. Trying to give them a great life. And then when I have some free time, I like to uh, I have like a very terrible race car. It's like very, an old Miata, and drive that on racetracks. And that's a lot of fun.
That's surprising. So you're a race driver?
It's not racing, it's just driving on the tracks and trying to learn how to do that, and it's a lot of fun. So, yeah.
Very, very interesting. Good luck with that. Sounds like something scary or at least dangerous, isn't it?
It's definitely like very adrenaline inducing. Yeah. But it feels pretty safe. Yeah.
I see. Good luck.
Yeah.
And as an accomplished scholar, as I already said, what is your advice to young scholars?
Really try to find a topic that you think is going to be exciting for you for a career. And it's hard to be strategic about it, but as you do work and as you think about like, read articles and like read books, you'll sort of see what you're gravitated towards, and that will help you find your own center of gravity and the kinds of work that you want to do. And if you're in the sciences, you're doing something, you should be doing something because you think it's important to you or to the world. And I would try to tell them not to be like overly strategic in trying to pick whatever topic is trendy right now, but to find something that they're really passionate about, that they will have sustained interest in for an entire career.
And sometimes you get lucky. I assume, for example, your own research, you became interested in algorithms, I think, before they were so popular.
Yeah, I mean, a lot of it feels like at that time, like doing science fiction, right? So if you're on
Kind
that
of, yeah.
fringe, and then you're lucky if it works out. And
Yes, definitely.
yeah,
But luck come if you work hard enough and try enough things, I think.
I hope. Yeah, yeah.
We approach our last question, uh, and it is, which book would you recommend us to read? We cannot read your yet, the new
Yeah.
one.
I mean, I think for folks interested in this field, the original like judgment and decision making or like heuristics and biases books. There's a Danny Kahneman and Amos Tversky and also like Griffith and Gilovich all co-edited these like series of books about that are really sort of the canonical articles in judgment decision making. And if there are folks who are interested in the field, I think those are really great books to read, that have a lot of sort of early work that laid the foundation for what people are thinking about today. And those are a little bit more dense. If people are looking for more kind of popular books, Richard Thaler has like a book called Nudge with Cass Sunstein, that I think is really, like a great way of thinking about how do these kinds of decision biases influence bigger sort of choices in government or choices in business. And Dan Ariely has a book called Predictably Irrational, which is really interesting about how these kinds of biases influence like individual choices. And those are great places to start. A more recent book, sort of in that genre, Katie Milkman has a book called How to Change that tries to help people understand some of their psychology to understand how to change their behavior and habits. So those are all great places to start.
Thank you very much. This was very, very interesting conversation. I again, encourage those who have not heard the original seminar to listen to it as well. And again, thank you for your time
Thank you
and
so
for being
much.
with us.
And thanks for having me.